For somebody that gets frequent bags under the eyes, dark circles, what's going on there?
So this is a common question, not only by patients who come into the clinic, but online for sure. Uh, Cosmetically, if we look in the mirror in the mornings, the eyelids may look a little puffy, especially if you had a late night. Maybe you had like a cheat day the night before, and I've done that before. I'm like, I'm just having a bad time. I'm just craving like a meat lover's pizza or something, and the next day I just feel kind of gross, from all the salt and all the extra calories and things, and um, but my face will look kind of puffy and swollen. So there are actually two different things. There are dark circles around the eyes, and some people genetically do have higher pigments on their skin and around the eyes, which can create the appearance of this darker circle, like raccoon type of eyes. Uh, but then there's also the swelling of the eyelids. And the swelling of the eyelids can create a shadow effect that also makes the eyes look like they have dark circles. So, uh, the first thing, if you ever see an eye doctor for these conditions, they have to look at it from those two perspectives. Like, is this just swollen eyes? Is it hyperpigmentation? Or is it a kind of a mix of both? Swelling of the eyelids can occur for multiple different reasons. The older you get, you have a higher risk of it. And they've done studies that show this. But the swelling of the eyelids usually does resolve on its own within 2 hours after you wake up. An easy thing you can do if you're really worried, like you have to get into work or something, or you're going to take photos, you can get a cold compress. You can something that is cold. You can, like, if you have a swollen knee or a swollen elbow, you can put cold compresses on it. Doing that for 10 to 15 minutes. Not, but I always say be careful. Don't go over 15 minutes. If you go over 15 minutes, it can actually cause vasodilation and make things worse. So, cool compress to the eyelids. They sell eye masks, like cooling gel eye masks too. I usually keep one in my freezer just in case. So that can be helpful. Um, there are eye creams for like swelling or eye bags. The creams often have caffeine in them and various other ingredients to constrict the blood vessels, right? If there's fluid there, they want to constrict the blood vessels, reduce the amount of fluid that's coming from the blood vessels to that area. And they work temporarily. Um, uh, so they can have their place, but they're not going to be a magic cure or anything like that. The pigmentation that people can have, there are also creams that help with hyperpigmentation, but they often take multiple weeks before you notice a benefit. I've seen some publications showing it takes at least somewhere between 12 sometimes up to even greater, like 16 weeks of treatment with those types of eye creams to decrease the amount of pigmentation around the eyelids. So those are a couple of methods. As people get much older, like if you're 40, 50 and above, if you feel like your eyelids are chronically puffy, like not just in the morning, but all day long, and uh, it's not just due to like salt retention or you had a long night the night before, then it could be because of septum changes. And what I mean by that is the eyeball has fat around the eyeball in the orbit, and you have this tissue called a septum, and the septum holds the fat back. And as you get older, the collagen of your skin starts to change, right? Our facial skin starts to sag a little bit as we get older, um, and so for older individuals, unfortunately, the septum becomes loose and the fat pads start to creep forward, and it creates this appearance of just baggy eyes. For that, seeking care from either a well skilled plastic surgeon, or there are specialists in the eye care field called oculoplastic surgeons who just do surgery on the eyelids. They can do some kind of their own magic to tighten up the area around the eyes so that you can get rid of those under eye bags.
And what about an eye twitch? When one of the eyes just starts uncontrollably twitching on you, what's going on there?
Yeah, really good question because stress, we know stress affects our bodies in so many different ways, right? Uh, Eyelid twitching, the medical term is called an eyelid myokymia. And so this is kind of a twitching that you may feel on your lower eyelid, top eyelid. It's usually kind of off to the side, and it seems to just kind of come and go. It's not like a full like spasm or closure of the eyelid, but it just sort of flutters. It's really annoying. I first experienced this in college, and I went to my eye doctor. I had it for like a few months. Went to my eye doctor, and he just told me, "Dude, you're too much stress. You're drinking too much caffeine, and you're not sleeping enough." And at that time, I remember telling him like, I don't drink caffeine. At that time, I didn't drink coffee or tea, and I've told him I don't feel stressed. But then I went home and I started journaling and listing out everything I was doing in my life, everything I was trying to control and hold on to, whether it be school, whether it was work, whether it was relationship things, planning for the future, because I was applying to optometry schools at the time. And I realized as I was making this list of every little thing I was trying to manage and do, I was like, oh my God, I really am stressed out. And I just had grown so used to it. So for most cases, if you experience an eyelid twitch, best thing is to reduce your caffeine intake or other stimulants, get better sleep, focus on your sleep habits, and then try some way to decrease your stress. Even if you don't feel like you're stressed out, maybe taking note or trying some new stress relief sort of activities. I personally love yoga as well as meditation, and there's good evidence that certain breathing techniques and things like meditation can reduce stress biomarkers in the body and can have a benefit to eye health as well.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body too.